to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Denice Hilty. She'll be speaking on how to prepare your body for optimal fertility. Dr. Denice Hilty is passionate about helping individuals and families in New York City create optimal health. In addition to being a skilled chiropractor, Dr. Hilty has done extensive study and been trained in several additional methods of healing. In addition to practicing in New York City, she has recently relocated to Providence, Rhode Island, and plans on expanding her practice there. Understanding that imbalances can show up in the body on the physical, mental, emotional, and spiritual levels, Dr. Hilty helps her patients discover the root cause of the imbalance and assist them in releasing and eliminating those issues. She has found through her experience that supporting the body's wisdom and natural state of optimal health yields the best long-term results. Dr. Hilty is continually expanding her knowledge and skills by studying new ideas and research, as well as attending seminars. This love of learning and helping people is what guided her to become a natural integrative healthcare provider. Dr. Hilty enjoys assisting people of all ages who want to create useful changes to their overall well-being. Welcome, Dr. Hilty.
Thank you, Dr. Laura. Thanks for having me. I'm happy to be here and share whatever information I can.
Yes, it's going to be awesome. We're going to have a lot of really important information that's going to help, I think, clear up some of the myths behind fertility issues and how to get pregnant and really what that means to create an optimal setting for healthy conception as well as healthy pregnancy and child. So let's start off with talking about what lifestyle modifications can assist with fertility.
Okay. Well, typically, a lot of people, when they want to conceive, it's very exciting, and it's a big decision to make for a lot of people. So they're really focusing on the end result at that moment, which is that positive test, which is very exciting. However, I think when you consider conceiving and bringing in a new life, what can be most useful for people is really looking at what conditions can I create in my body, in my mind, and my heart that are going to be ideal for conception, pregnancy, and a healthy child and a healthy family. So you're not just trying to reach the finish line of a positive test, because once you get that positive test, you're still going to be carrying that child, hopefully to full term, and then that child's going to grow up into a hopefully healthy, happy adult. So when you start the journey of conception, I always like for people to contemplate, what can I do to create the best possible conditions to have someone, for women anyway, for someone to be gestating inside me? Like, what could that be? So with that said, many times it goes back to healthy lifestyle. That's probably one of the most important things. So conditions for pregnancy, people get pregnant all the time, but they need to be absolutely perfect for that sperm and that egg to fertilize and to be implanted and to hold on to that pregnancy. So it is truly a miracle, and we want to cultivate whatever conditions those are, okay, which we don't even know all of them, but we have an idea. So the first thing, I always tell people to focus on what they have control over, okay, because there are a lot of X factors with conception, and again, some we know and some we don't. So focusing on what we have control of is your own body and your own thoughts and your own behaviors. So the first thing that I feel is the most impactful is your nutrition. So what you're putting in your body on a daily basis, whether it's food, drink, toxins, whatever it may be, in and on your body. So food is the biggest one for optimizing. So obviously, if we want to create great conditions, we want to look at, okay, what is going to be the most nourishing and what can we avoid to not clog up our body and add in toxins. So I like to give very general guidelines for people because I think most people do best with that. The two main diets that I recommend for preconception, and I usually say start this right away. So if you're not going to start trying to conceive for a year, it's a good idea to really start thinking about this now, not the month that you start trying to get pregnant. Okay, so you really want to say, what can I do to get myself ready for this important process that I'm about to undertake? So the two diets that I feel that most people like and do the best with are the paleo diet. The paleo diet, just a short answer to that, of what that is, it's fresh whole foods, including meat, poultry, fish, eggs, and vegetables, and all kinds of fruits and nuts. So it mainly cuts out grains. You can do quinoa, which is a modified paleo diet. And most people, there's plenty of delicious things to eat. Most people don't feel like they're being deprived. There's great baking recipes that you can do if you want, like baked goods and things like that. It's just made with different types of flour. And most people, if they're having infertility issues or they're trying to get healthy, most people respond extremely well to that diet. The other one that people respond well to is the Mediterranean diet, and that's a little bit different, and that's abundant in fruits, vegetables, whole grains, legumes, which are beans, olive oil, and then typically it's fish and chicken, not as much heavier meats. And most people within a few weeks will feel a lot different within their body. I just want to point out, you notice that none of those diets I mentioned have like the boxed food. Typically putting more natural things into your system gives your body what it needs, and it also helps your body rid yourself of waste and toxins. So those two diets are very general. You can look them up online. Paleo diet, WAM017 has wonderful information and really, really good recipes. The Mediterranean diet, there's several websites that go into the benefits, and also there's a ton of recipes and books and things like that written about both. So if you're interested in that, you could probably just look online and have a good understanding of them. Mm-hmm. The other thing is putting things, people think about food as far as how that impacts your body. The things you put in your body is important, but also what you put on your body. So getting rid of beauty care products that have chemicals. There's things, what we call them endocrine disruptors. Endocrine relates to hormones. Hormones are extremely important for conception with men and women. And I want to point out, it takes two to conceive. So, you always want to, as a woman, you want to include your partner in any discussion about fertility, of course, and the decision of having a child. And also, there's a lot of studies that show that the men's health, even though you're gestating the baby, but the health of the sperm is extremely important to the health of the child. And the more time that goes on, the more and more we're actually beginning to understand this. So if you start a certain lifestyle, and it is nice to have a partner join you in this anyway, but you do want to talk to your partner about healthy living as well, because it will and can impact your ability to conceive and the health of your child. So that's important. So beauty care products, you want all natural products. Makeup, fragrances can be very toxic and have no endocrine disruptors in them. Cleaning products in your home, you want to look at clean water. Okay, and these are all great things that are going to benefit you no matter if you want to have a child or not, and that are going to create that healthy family environment that most people are looking for. So water filters are great. Now, it can be hard to navigate, what's a good water filter, what foods have endocrine disruptors in it, what products, like sunscreens, and, it can be very overwhelming. Plastic water bottles. So there's a great organization that has lists of these types of things to help guide you into better choices. It's called the Environmental Working Group. They do a lot of research, and they provide a lot of consumer lists to help with this. So the website is ewg.org. It's called the Environmental Working Group, and they're a fantastic organization. So the good news is there's plenty of products out there nowadays. to substitute the things that you're taking or putting on your body or in your system to clean up your home and to clean up your body. The other thing is a big one for people, especially in the New York City area, is caffeine and alcohol. So if you want to have a little bit of coffee every once in a while, that's fine, but don't make it a habit anymore. They have linked, and some of these studies are, you can find one study that supports it and another one that doesn't, but we know caffeine is a stimulant, and it's not really useful or supportive to the body. So limiting caffeine, if you want to switch to herbal tea, even a little bit of caffeinated green tea is better than coffee, and then also limiting your alcohol intake, which they've linked to decreasing your chances of fertility. So just minimal or moderate alcohol use and minimal or just getting rid of coffee altogether and switching to herbal tea or even caffeinated green tea is going to be better for you. Mm-hmm. So those are the big ones. And, typically those things are pretty doable for most people. You don't have to do everything at once. You don't have to wake up and just completely change your life. Most people do well with starting things gradually, setting goals. It's easy to switch out your beauty products. Or you can say, I'm going to start conceiving in a year. When this is done, I'm going to start switching to more natural products. But typically you're going to be more successful and consistent if you do this over a period of time and you mentally prepare yourself for these changes instead of setting yourself up for failure. Right. So just ask yourself what you're willing to do in the beginning, and then you can make some of these gradual changes to help support your body to be healthier, to limit the waste and the toxins that are going in, because there is a lot of waste and toxins in our environment right now. Some we have control over, which is what you would want to focus on. Some we don't. And then really examining your food. So you might need to start looking at labels and examining drinking water and things like that. And again, all these things are going to help support a healthy pregnancy. Remember, your baby's going to be sharing your system with you, your blood. So we want to do as little as possible to pass on waste and toxins to a fetus. And then when we have our baby, most women choose to breastfeed, and they recommend that now. So you can pass toxins and waste in breast milk. And then also the home environment you provide, you want to support your child with healthy, nourishing food and limited toxins. So again, all these things are just really going to benefit you, your child, your family, moving forward, indefinitely. So that's a really good investment to make if you're having fertility issues or if you're considering trying to conceive in the near or far future.
Mm-hmm. It's such a good point. And, technology has really helped to assist us in making better consumer choices. I did an interview with a naturopath on improving the microbiome, and she also referred to the Environmental Working Group website, as well as they have apps, the Harvest app to help with choosing foods that are organic and non-GMO, and then the Skin Deep app, which is helpful for choosing skincare products that don't have those endocrine disruptors that you mentioned through the chemicals that are in there.
Absolutely. And, those are fantastic. It can be overwhelming and hard to navigate, and those are great tools just to give you a definitive answer as to what to do, how to take action, like what can I do to replace this. The other thing that can be tricky is we can't measure some of these toxins in our bodies. So we just want to take strides and steps to eliminate them. Because, obviously if we look at our culture, a lot of it is diet related, but there's a lot of toxins floating around in the U.S. and other Western and Eastern countries, and clearly they're manifesting, and I think everyone would agree with that, as health issues. Yeah. So again, to safeguard your health, you really want to be mindful of these hidden toxins, and it is a little bit disturbing that a lot of these toxins they put in products or foods without really explaining the risk. Yeah. And that's where, as a consumer, you really want to educate yourself. Because I think some people go into purchasing foods and other sorts of products, thinking that we're being protected somehow. And oftentimes there are harmful things in those, including baby products. So you really want to be an educated consumer when you do put things, again, in your body or on your body. Because if they don't always tell you, or they don't always, by law they're not required to, which is why they don't do it.
And sometimes the labeling is very misleading too.
Sure, yeah. So just being an educated consumer, and I believe on that website they bring up tips and they go over these words. Hopefully, if you do these diets, you're not going to see these words as much on the things you purchase. But understanding what those, if you do buy a skin cream or something and there's a word you can't pronounce, typically this website will tell you what that is, and they have very concise lists of 12 things that you want to avoid, for example. So it is worth downloading those apps if you have a smartphone or an iPhone, so you can just reference them when you're in the marketplace for those things.
Yeah, and sometimes you can just scan the barcode and it will immediately tell you what's in that product and if it's safe or not.
Yeah, so that's great. And you did bring up a great point of organic, obviously, is ideal. Certified organic, and also certified organic is non-GMO because we don't really know how those things are affecting us. So I always say it's better to be safe than sorry. Okay. Now, if you have a weekend where you eat normal food, it's not the end of the world. But overall, you really want to practice healthy living. Healthy living. You want to live a long, happy, healthy life. You want to have the family that you want if you choose to have a family. And, these things are going to help support that and safeguard your health.
Right, and it's not even just about the longevity, it's the quality. And we know that toxins create disease and inflammation and symptoms and pain. So the less toxic our bodies are, it's going to not only help us feel better physically, but it also will help us emotionally have improved mood, and that will impact every part of our life.
Absolutely. And, also you think about your child, like such an immature little being being exposed to these chemicals and hormones and whatever else they put in our food and our products. That's a tough way to start. And that's why I feel, and I know a lot of other people feel, that's why some children really struggle. They have allergies, they have digestive issues. They're basically come out that way. So we want to take the stress off the nervous system as much as possible, our own, and then we want our baby to be born fully expressing its nervous system without dealing with any challenges. And again, we can't control every factor out there, but just controlling the things that we know about is where I would put your time and energy and your money, quite frankly, to do the best you can just to safeguard the health of everyone in your family, born and unborn.
Right, and that's such a good point, too, is as educated consumers, our dollars are really going to hopefully help shift how things are produced, whether it's food or skincare or cleaning products. If we only choose to buy healthier options, then it's going to drive the industry of what they're producing.
Absolutely. Yes. Agreed on that. Yeah, and that's where, we're getting into like local farming practices, and, people think, oh, well, organic's so much more expensive, for example, whether it's a local farmer or just at your local grocery store. But they're not understanding what the differences are. They see the price tag and that it's organic, but, you're not getting the pesticides that you would get in regular produce. Pesticides are definitely neuroendocrine disruptors, and they do all sorts of other things. There's a lot of research out there. If you're interested, you can look it up. And also the genetically modified foods, we're not really too sure about what that does. There's some very disturbing studies that tell us how the genetically modified means that the DNA of the cell in a fruit or vegetable or whatever else, because they're doing all sorts of things now, is modified. So it's not how nature made it. They're kind of monkeying with the genetics. And when we eat that and we ingest those cells, because, living things are all made of cells, we're not really sure how that affects our physiology. So, there's some studies, again, that show extremely disturbing results, and other ones that they say, including the FDA, says it's fine and, we're free and clear. So for me, I personally I always go with nature. Yeah. I trust nature. There's an order and a wisdom to nature that's unparalleled. So I trust that more than someone in a lab looking at things and trying to extrapolate, lab findings to health and well-being and things like that. So, if you do spend the extra money on organic, you have to consider what you're getting. You're getting more nutrition. You're getting less chemicals. Yep. And you know that the food is coming from nature. Yeah. So if it's 30 cents, usually I've been looking because now I live in a normal area and I can go to the grocery store and take my time. It's not as crowded. And the price differences are not huge. Everyone's on a budget, and the Environmental Working Group is also a great resource for that. So an organic banana isn't going to be as important as an organic apple, for example. Right. So you can really navigate that, where you want to put your money as far as certain items. Certain items you want to invest in the organic. Other ones, if they have a peel or things on them, you don't, but then you want to look for genetically modified as well. So, as long as you're educated, you can make empowered choices. Right. And that's really what it's about.
And the scary thing is that, I believe almost every state in the country is not currently requiring GMO labeling. So you really have to look for a label that would say non-GMO to have that awareness. I know Vermont passed that law, and they've had a huge resistance from the grocers, the people that make processed foods essentially and foods, and are suing Vermont, and other states are going on board and trying to pass these laws as well. But it's not across the country yet, and it's unfortunate. Every part of the country should have that awareness of labeling, so we can be making even more educated decisions. Other parts of the world don't even allow GMO seed to be grown and sold. So this is something that we really need to speak up about and let our lawmakers know that this isn't okay to have GMO food on the shelf and not have it labeled.
Absolutely. Yeah. And the other thing with GMO, just rooting it back to fertility, is GMO, one of the reasons they have GMO is so these produce can be more resilient to extremely toxic pesticides. So, if you go out into your backyard and you spray these extremely toxic pesticides, then there's going to be a lot of death, of the greenery or whatever you're spraying it on. So they make these foods a little bit more resilient so they can handle the pesticide. And, I understand the premise. There are bugs, they're eating their crops, but in the meantime, they're poisoning people, and the produce is allowed to flourish even though they're being soaked with dangerous pesticides. So I think people say, oh, it's just GMO, I'm sure it's fine, but they're not really understanding some of the things that are connected to what that GMO means. And, these are known neuroendocrine disruptors, they're known toxins, carcinogens, they're not sustainable for life, which is why they kill insects. So in small doses, sure, we can live. Yeah, absolutely. But, these things do accumulate in our body, so you want to be mindful. And, infertility has gone up since the 80s, I want to say it's increased threefold. I just saw a statistic, and I don't remember exactly what it was, but it's definitely increased. Where there's a lot. It's with men and women. It's not just women. That's a big misconception. So, what's going on? What's causing this? And sometimes we can figure it out if it is a hormone issue. And even if hormones are disrupted, well, why are the hormones disrupted? Right. And how can we shift this symphony is what I call it. When you ovulate or when you cycle, remember the cycle of the menstrual cycle is connected with the moon. So we're very connected with the earth and the universe, actually. If you look at the endocrine system, we have different cycles in our body that link up with different processes, So typically we should be linked, and it should be this harmonious symphony of hormones, and everything has its place and its purpose. And then if everything happens in the right way, you ovulate. And if you conceive, if sperm meets the egg, you conceive. And then from there, there's a different harmony or symphony that starts to play. If you don't, then it's still very natural, of course. And things, you go into the luteal phase of your cycle, and then you start over again. Well, a lot of women don't have that symphony of hormones. There's for example, I know a lot of women when they start trying to conceive, they don't know if they're ovulating. Like, I don't know when I'm ovulating. I don't know if I'm ovulating. So there's different ways to monitor that. But first, you really want to step back and look at your cycle, because our body is great at telling us if there's an issue or if there's an imbalance. So, are you regular? There's great apps for tracking your cycle. You can track all sorts of things related to it. There's a million of them now. So you want to track your days, of course. You want to track how your period starts, meaning if you're having symptoms. PMS, for example, is hormone imbalance. Do you start with red blood, meaning that bright red blood? Are you spotting and then starting? Okay. Now, if you're not having an ideal cycle, which would be just starting with red blood, it means you have a hormone imbalance. Does that mean you can't get pregnant? No. Okay. But again, we want to work towards optimal health. Okay. If you're not getting your cycle every month, then we know there's something going on towards the end of your cycle. But also, as a more functional medicine practitioner, it's not just about progesterone's the problem. There's usually a lot of other things going on that are creating the conditions. Remember, we want to look at conditions that are happening that aren't allowing for a healthy cycle. So food can absolutely impact your cycle. So the things we talked about before can really actually help regulate your cycle, surprisingly. Yes, and, cutting out sugar, cutting out processed foods, wheat, things like that. They've been known to interfere with a healthy cycle. So getting those out is a big thing. Now, if a woman doesn't know if they're ovulating, there are ways to check that. Now, the only way to really know if you're ovulating definitively is through an ultrasound. Okay, so they check before, pre and post ovulation, so you can see the follicle, and then they'll see an empty follicle, meaning the egg is ruptured. Okay, so ovulation means that, just to go over it with some people, ovulation is when an egg ripens to the point where it ruptures out of the follicle, okay, and then it goes down into your uterus to be fertilized. Now, sometimes people can cycle, but they may not be ovulating. Okay, and obviously we need to ovulate if we want to conceive. So, and a way to check that without an ultrasound is I find the Clear Blue Easy monitor to be pretty accurate. I like the monitor better than the sticks because the monitor kind of learns the woman's body specifically. Again, even if it shows that you're ovulating, chances are that you are, but it's not necessarily the case. Okay, again, the only thing that can definitively tell you is an ultrasound. But at least it can tell you timing and if you're having those peak hormones that create the conditions for ovulation. Now, if your body's not creating the conditions for ovulation, there are things to do. Now, there is a big gap between I want to conceive and my cycle isn't regular and it's all over the place and I'm not ovulating, and going straight to infertility. Right. Okay, so there's this gap, which in my opinion is ideal health. So like you want to get your body functioning, again, to create the conditions for conception and pregnancy as well as health. okay? So there isn't, I feel like there is a big gap in the healthcare system for supporting women who need a little bit of help getting things regulated and changing the conditions of their body to allow for conception. And that's where some of these recommendations are really going to help support that. So if you're already ovulating and things are great, that's good. These things are still going to benefit you. But if you're having some struggles with your cycle or fertility, these things can definitely optimize and help, okay? So you really want to look at that and see where you are in that spectrum. And if you need further information as to what's going on with your body, you can get, a gynecological checkup is always a good idea to get screenings for, STDs and just checking the plumbing, is what I call it, before you start to conceive, which is fine. They can't always tell you about hormone function and things like that throughout your entire cycle, but they can check levels. I personally use saliva testing to check hormones throughout the month. So I like to see what a woman's doing from day one to their next day one. So day one is when you get your cycle. You check estrogen, progesterone, LH, FSH, DHEA, like all the things that help that harmony, that symphony that I was talking about. We see exactly where you are throughout that cycle and see where you're doing well and see where you're struggling. And then from there we do more targeted nutrition, clinical nutrition, which typically involves vitamins, minerals, herbs, homeopathy, depending on what you need to kind of get that cycle back on track in a natural way. So there are alternatives and there are solution-based ways to help you kind of get things back on track if they're not on track, but really understanding where the problems are is going to be important. That's where the testing comes in. But again, every single one of my patients who comes in for either just because they want to get their cycle regulated or they're trying to conceive, all these things that we're going to be talking about even more, the food, the avoiding the endocrine disruptors and the other toxins, like this is an integral part of their treatment plan. So, and it's hard to just take a few supplements and not change your life and get the results that you want. I'm not saying that you can't, but definitely the more health that you put into your system, the quicker that you're going to get results, the longer you're going to stay healthy. And, we really want to restore health. We just don't want to fix a problem. So when you restore health, your body's wisdom knows how to cycle properly. For whatever reason, it was interfered with, through food, trauma, thoughts, or toxins. Those are the three big ones that interfere with the body's functions. So when we remove that stress and we give the body what it needs, that's when your body naturally starts to regulate. And that should be permanent if we're addressing everything. And then, again, you're going to have the benefit of having that long-term hormonal health, as long as you continue to take care of yourself. So there are alternatives to, I'm not cycling well, I don't know if I'm ovulating, or I may or may not be ovulating every month, and jumping into infertility, okay, especially when you're in those prime fertility years. So that's definitely something to consider, and I don't think that's something that people talk about a lot. It's like I'm having trouble and you don't really know what to do. But there are beneficial things to do. And again, even if you do assisted fertility, you want to make sure that environment and the conditions in your uterus and in your body are ideal for a new little fetus to be taking up residency there. So it's not just about the positive pregnancy test. It's about, okay, let's get me balanced and healthy so I can flourish in my pregnancy and my child can get the best possible head start on life with a good, healthy system.
Yeah. We've spent a lot of time talking about physical action that women can take and really creating a lifestyle. So this isn't just to get pregnant, but really continuing not only through the pregnancy, but even ideally for the rest of their life to maintain and optimize health. Let's spend a little time talking about how the mental, emotional, and spiritual beliefs can impact conception.
Sure, that's a good one. Yeah, so with all this talk of infertility, I feel like it's a big decision for most women. Sometimes women just, they get pregnant and they weren't necessarily planning it and everything's great. And, and most of the time, at least in my practice and my life, people decide, it's a conversation that they have with their partner. So it's a big decision. And often there's a lot of things attached to it. So I find that even before you talk to your partner, if you're considering trying to conceive, I would recommend really examining what your beliefs are about pregnancy, conception, and motherhood. And if it's a man, obviously fatherhood. Okay? Because men, we're always thinking about us getting pregnant, but for men, this is a big deal too, even though they're not carrying the child. So you can also ask your partner how they feel about those things. So your belief systems around that. It's not uncommon for women of today. Most women have jobs and careers. It's not how it was back in the 50s where they just had a certain path of being a stay-at-home mom, which is a very important purpose, and a wife. But now women tend to juggle a lot more, and they have a lot more in their world. And sometimes they don't know how they're going to fit it all in, even though it's something that they want deeply. Okay? So I always ask women to really examine your beliefs about pregnancy, conception, and motherhood and how it makes you feel. Now, if you feel a little resistance to it, even though you want it, it's fine. It's normal. But if you feel there's something deeper than that, then I would contemplate that and, even talk to your partner about it and, check with him as well as far as what his feelings and beliefs are. Okay? So a lot of women come to me just to get their bodies ready for pregnancy, which I think is a wonderful thing. It's like a great act of motherhood, I think. Even before you're a mom, it's like such a loving thing to do. And a lot of them, I find, have this underlying anxiety of, and it may not even be based on anything physical, that they're going to have trouble conceiving. And I find that culturally infertility is such a rampant thing that a lot of women, their expectations are that they may have trouble or that they will have trouble. So I always try and have women do a vision statement even of, okay, what would your ideal situation be for conceiving? Contemplate how it's going to feel to be pregnant. Doing that positive pregnancy test, which I think everyone dreams of, peeing on the stick and seeing the positive. How is that going to make you feel? Just really seeing it. And then if they can't really see it, does it mean they're not going to get pregnant? No, it doesn't. But I find that energetically, we really want to be in alignment with conception. And if we're having internal resistance and our body's always working towards supporting us in health, then sometimes, things don't happen. In my opinion, things don't happen as quickly and as easily as they could. So I think that's a step that some people, the idea of having a child is great, but when you really think about what your life is going to be like, I think it's important to look at that and then examine your beliefs around what that means to you, and if you're ready to do it, as well as with your partner. So that's the first part, is resistance. Is there any resistance? And you can work through those things. It doesn't mean that, you're not going to ever have kids because you're terrified, I think it's kind of a mature thing to be a little bit scared because it is a huge responsibility. It's a big life change. So to have a tiny bit of fear around it, is not, unheard of by any stretch. But working through that, I think, can really optimize your chances of conceiving when you're ready. The other one is visualizing. I just want to go back to that, and that's extremely important, and just really it's feeling congruent with what you want. Wow, I can really see myself pregnant. This is, even if you don't have a reference for what being pregnant feels like, this is going to be great. What's my life going to look like? And, if some people can just let go and go with the flow, and other people need to plan, and they can be like, oh my God, what am I going to do with my job? What's going to happen? Before they even start conceiving, they have these thoughts. Oh, what kind of mother am I going to be? And examine those beliefs. Well, why do I think I'm not going to be a good mother? Ask yourself these questions. And also, if you need to have conversations with your partner, well, what's going to happen when we have the baby? Financial conversations, taking time off, how's that going to impact your family? What if you wanted to stay at home? You decide, how is that going to work? Is that a doable thing? Removing some of the barriers behind where this anxiety is coming from is the best way to go. And, it doesn't mean you're going to figure out the world, but opening up the conversation and examining your feelings and your thoughts is going to really help expedite the process, and it's just going to feel better. It's going to take stress off. Stress hormones can definitely interfere with conception. When we have a thought or a feeling, there is a biochemical response. So how we're feeling within our body will manifest on the physical. So a little stress is okay, but if you're living an 8 or a 10 constantly, that's something that you might want to look at and consider shifting before you conceive. Okay? Again, it's what type of conditions do you want that child to be living in? Having a baby gestate in someone who's in sympathetic overdrive, which is that hyper stress response, is not ideal either. Babies come out feeling like they have to, it's a hostile world. There's been studies on that as well. They have more muscle, that fight or flight. Some studies show that their IQ is lower. So, what conditions do you want to create, and have those conversations and, have a loose plan, because things can change, as to what you and your significant other, if you're doing it by yourself, that's fine. You can have a conversation with yourself or with a friend to help you, to help bounce things off of and come up with ideas. But try to resolve some of that within your mind and heart before you conceive, because it'll benefit, in my opinion, it'll benefit the conception process, and it'll definitely benefit your pregnancy and your labor and delivery.
Right. And even just becoming that mother and having less anxiety after the birth.
Absolutely. Yeah. So again, I think any woman who's, maybe, even of all ages actually, but especially women in the New York City area, who a lot of them have careers, they've invested a lot of time and energy, and making a shift to conceiving and pregnancy and motherhood is a big one. And it's something that they deeply want, but they don't know how to coexist with all the other things that they have in their life, So it's not an uncommon thing in my practice anyway to see women who, it's something they want, but there's still a level of anxiety either about the process or even it not happening. So I think examining that and almost neutralizing it, and, some things we don't know, it's like being okay with the unknown, So there is a process of planning. There is a process of having conversations. And then there is the unknown, and it's almost how can you coexist with the not knowing when you're going to get pregnant, not knowing, what type of baby you're going to have, or, there's all these details that are left to the future that it doesn't benefit us to have anxiety or dwell on, because it's not going to move us any closer to what we want. So, doing different techniques to help diffuse that anxiety, if you're a thinker, is only going to help your physiology. Again, every time you have a thought or feeling, there is a biochemical response. And just, do what brings you more peace. What's going to bring you peace in this situation. And a little bit of stress and anxiety once in a while is okay, but again, you don't want to live there, and you don't want to be obsessed. That's definitely not. And I know it can be really a hard process for some women, but it typically doesn't move you closer to what you want.
And if someone is, examining their beliefs and perhaps recognizing that there's some limiting beliefs there and are feeling challenged on how to move past it on their own, there's some really wonderful energetic modalities out there that a woman who's preconception can utilize to help her move past this. And some of it could be at a very deep subconscious level, so it's hard to even become aware of it on your own. And so things like NET, neuroemotional technique, or EFT, emotional freedom technique, Psych-K, these are really wonderful modalities to help with those limiting beliefs.
That's a great point. And, I don't know about the other two modalities online, but if you Google EFT pregnancy or infertility, usually there's YouTube videos for EFT, and they'll walk you through. For those of you who don't know what EFT is, it's a tapping technique. You tap on different acupuncture points, and it basically helps shift that charge of that emotion. And it's the opposite of, affirmations are great, being positive is great, but you never want to discount how you're feeling. So being positive when it's not really authentic on the inside is not going to benefit you as much. So EFT really gets into the groove of, wow, let's really look at this. Like, let's see how anxious you are. Let's allow yourself to actually own that in that moment. And while you're doing that, you tap on these meridian points, and it helps neutralize that charge, and it makes life feel much more peaceful, much more joyful. And, talking is really important too. If you have a friend or your partner you want to, talk about your feelings with. But again, you want to move through the things that are causing you disharmony. And the techniques that Dr. Laura brought up are great solutions for helping with that. And you can always see a effective therapist as well. Yeah. But, just not, being proactive again. It's about being proactive. You have control over your thoughts. So being proactive about the things that you have control over, okay? I find that most people do very well when you focus on the things you have control over when you're dealing with conception. All the things that you don't have control over, it's just best to let it go and find peace with that. And if you're one of those people who likes to think and kind of, trying to control things that you will never have control over, that's when some of these techniques especially can be really useful to you.
Yeah,
okay, so you
definitely
can experience more peace in your mind and your heart, which allows for you to be happier, for lack of a better word. And, we were talking, Dr. Laura and I were talking before we started, and, conceiving is, there are things you want to take action on. Absolutely. Okay. As far as healthy lifestyles and being, proactive and positive and if you need to take a further step for different evaluations, absolutely. But there also is a component of conception that is the letting go, or the female, usually male energy is very action-oriented. Go get them, do it. Female energy is more receiving.
Right.
So it's almost like the art of doing nothing, okay? The art of, even with thoughts. So if you really, really want something, it's okay to want it, but you don't have to hold on to it so tight, So letting go and allowing for things to happen, okay? And I think that's extremely important. And from a personal perspective, I think everyone's heard these stories, but I'm the youngest of three, and my parents adopted my brother and sister. And when they were in the process of adopting my sister, she was 10 months old. I'm sorry, she's 10 months older than me. But when, she was like 2 months, I think, when they were adopting her. And when they were adopting her, they found out they were pregnant with me. Mm-hmm. And the same exact thing happened with my cousins. They had 2 adopted children. The third one, I think they probably felt their family was complete and they could move on. And I think somehow energetically they let go. Yeah. And then it happened right away. So, that letting go part is a important component, because I understand it can get all-consuming, when it comes to conception and fertility. But making sure you're doing other things in your life and you're focusing on other things and you're allowing is an important part of the process.
Yeah, it's the grace component. There are things that are out of our control, and that's okay. We can
right.
see.
And then, if you're someone who needs to work on, making it okay or it being okay, then it's a really good opportunity, because if you're doing that about conception, you're probably going to be doing it about other things, and have done it with other things, and it never feels good. Yeah,
right. So I wanted to also explore a little bit about, because we had talked about this earlier, when a woman is trying to get pregnant and has not had an immediate response, let's say within the first couple of months, when is the right time for her to actually start seeking help from a healthcare provider, and how can she find the right provider to work with?
Okay, that's a great question. So basically, it really depends on, it depends on the personality of the person, and it depends on really what you're looking at. So, for example, if someone is having those irregular cycles and they know something isn't right, then I would say seeking help right away is important. I would recommend a functional medicine or people like naturopaths, chiropractors who practice more alternative types of health care, even acupuncturists. They do a lot of infertility work, someone who specializes in that, to really start to help get you back on track to help regulate your cycle. So in that situation, I wouldn't wait. I would just start that journey, obviously start eating healthy, incorporating some of the things that we've talked about here. I think starting right away is the way to go there. Now, if someone has been charting or doing the monitor and they know they're ovulating every month, they have a normal cycle, and, let's just say everyone's a little different, so I'm going to give basic guidelines. Say you're below 35, I would say, giving it a good year is ideal. If someone can't wait a year because, they have all this anxiety and things like that, and they want to take action sooner, I still would recommend a more alternative healthcare provider instead of going directly to assisted fertility, unless that's something that you really want to do. Again, we want to make sure the conditions are right. So typically on a more functional healthcare or integrative healthcare doctor is going to look at physiology. They're going to look at other things that they might run some tests on you. Like I do blood work, I do saliva testing, things like that. A lot of other doctors do that as well, just to see if there's anything going on. And then, make changes based on what that doctor says. And then I would wait at least another 4 to 6 months before you go the assisted fertility route. I find that, again, what I was saying in the beginning is you can't conceive and then you go to assisted fertility. And there is a big gap in helping to restore health and function. And again, you can probably, not everyone, but you can't always get results with assisted fertility. But say you do, you still want to make sure that the conditions in your body are ideal for pregnancy and conception. So if you're over the age of 40 and again, if you don't have a regular cycle, you want to seek help right away to get things restored. And I would say after 6 months, you would want to probably do an assisted fertility consultation. It doesn't mean you have to do anything. But if you've already been evaluated, the only reason I say that is because typically between the ages of 41 and 42, egg quality can drop. So even if you have very balanced hormones, you're eating healthy, you're doing everything right, we still need to have a healthy egg. So everyone's different. I know some of my patients, some of my personal friends have gotten pregnant within the first 6 months of trying. So you can definitely get pregnant when you're over 40, but obviously more women have trouble in this age group. So the only reason that I would say to go sooner than later, like after 6 months, is because of the potential egg quality issue, which is very time sensitive. Between the ages of 41 and 42, again, people get pregnant after that as well, but statistically, the quality of your eggs starts to drop a lot more dramatically. And then from there, you want to make sure that you're going to a fertility clinic if you do choose to move forward with assisted fertility. That is going to be the most effective. With that said, I am pregnant now. I'm 30 weeks, and I'm 42. I'll be 43 in November. My husband's 57, and we tried for a year. Everything was normal for me. I had very good levels. My ovarian reserve was good. My cycle was good. I was ovulating every month. Everything was fine. We tried for a year with no luck, no pregnancies at all. And so after a year, we went and I did 2 consults, one with a regular IVF clinic and then one with a clinic that does something called mini IVF. So that was when I had just turned 42 when we did that. So we went there, and for me, the approach made the most sense to me. So mini IVF is when it's similar to IVF in that they harvest or they retrieve eggs, and then they fertilize them, and then they implant them back. So what they do is they do much less drugs, which I was more comfortable with, and they retrieve typically less eggs under the theory that the egg quality will be higher. Now, this is a very new technique in the U.S. So statistics, there are no statistics yet, basically, on whether it's more beneficial than regular IVF, which is when they try to harvest as many eggs as possible, inseminate them. Typically, with a mini IVF egg retrieval, they harvest and inseminate few, and then you do more than one cycle. And then you accumulate what they call 5-day embryos. So they inseminate the egg, and then they wait 5 days for it to turn into an embryo. Many don't make it, especially in advanced age. So they basically want, I would say, 7 to 10. Usually they'll take 5, but like 5 to 10, you want to have at least 5 to 10 eggs with all your egg retrievals, basically. So again, it may take more than 1 month of doing these egg retrievals. I only had to do 2 months. So our outcome was extremely good for our age group. And then what I completely and totally support, and I think makes a huge difference with advanced age, is genetic testing. So once you get to the 5-day embryo, they culture the embryo in the lab, and they send it for genetic testing. Now, we had a lot of embryos for our age. I had 11. And we sent all 11 to the genetic test lab. So that means that they look at the chromosomes in the egg. The most common cause of miscarriage or infertility is egg quality for older women. So typically when someone has a miscarriage, it's almost always a chromosomal issue. I mean, there's other reasons, but that's the number one. So out of the 11 eggs, 2 came back as viable. And then obviously they implanted a viable embryo. And typically in mini IVF, they only recommend implanting 1 just because it's better for the health of the mother and the child. But, I'm sure they're open to doing more. I personally just wanted to do 1 just because even though I'm advanced age, it just felt like a healthier choice to me. So they implanted the egg, and then after that process, typically the success rate is between 60 and 80% because they've kind of ruled out those genetic chromosomes that are more common to cause miscarriage or for the baby not to reach full-term pregnancy.
Right.
So I really like that approach. It made sense to me, and it worked for us. So again, everyone's different. Just because you go down an assisted fertility route doesn't mean it's going to work for everybody, regardless of your age. But again, going with the clinic that works with the body's nature as much as possible, I think is the way to go, which is why I liked less drugs, because I don't know how that affects my eggs. And they're still, it's hard to measure these things. And I liked how they did the extra evaluation to ensure that we were going to have a healthy embryo implanted, because we could have had, multiple miscarriages. Unfortunately, there's a lot of misconceptions about infertility as well. So egg quality, the only way to tell if an egg is quality is through genetic testing. So looking at it through a microscope, it could look like a beautiful egg, and then you could have one that doesn't look so good, and the one that doesn't look so good could actually be the one that is genetically viable, and the other one isn't. So I feel like certain tests are extremely important to ensure your chances of a positive pregnancy test. But, it takes a lot of research, and, my husband and I definitely didn't want to have to go through unneeded miscarriages either. So for us, it was a very good fit. Now, with all that said, to optimize fertility, whether it's assisted, which would mean IVF, IUI is even assisted, even though it's just, injecting sperm in closer to your cervix to hopefully help increase chances. All the things that we talked about as far as diet, toxins, examining belief systems, all of those things are going to optimize whatever route you go. So a healthy body is going to be much more likely to house a healthy, happy fetus. Yeah. So, Mother Nature knows way more than any doctor or us. That wisdom is very powerful. So sometimes if it's not allowing for conception, there's a really good reason, okay? And trusting that is important. So we always want to optimize those conditions because we don't want to force anything and then have issues. So just getting healthy regardless, even if you have to do IVF, some people have to or they use egg donors because of ovarian issues. And I've had people in my practice come in who their ovaries don't work anymore because they had autoimmune disease or whatever else, and they had an egg donor, and they spent about 8 months before they went through that process just getting their body ready. So it's not always about just your own egg and your own sperm. You want to make the conditions. For all intents and purposes, she was the mother. She was the one gestating the eggs. So, and the fetus and the baby. And she had 2 happy, healthy babies. Yeah. So it's not just about if you can't do it naturally, there's another way. You want to incorporate these things to be successful and bring health for you and your child. It's one of the most loving things you can do as a mother before you even have a fetus inside you.
Oh, and this is really a holistic approach. It's not just take an egg, take a sperm. It's like we don't have to, life isn't cookie cutter, right? It is so much more.
No, it's not.
Complex.
Yeah, and that's where, when we were talking about the letting go and allowing, like you can do everything right. You can do everything right and still not conceive. It's just one of those things where you have total control over, So it's that letting go, and, you have to trust if you want a child badly, you will have one.
Yeah.
You will have one, and it just might look different. It might look different. Might have to do mini IVF or IVF, or you might have to do an IUI, or you may need to adopt,
right.
Or you may foster a child. If you want to be a parent, like if you want to be a mother or a father, like you will have a child if you want it bad enough. And just being proactive, focusing on what you have control over and not being attached to what that looks like is probably the best approach you can take.
Mm-hmm. Yeah. Makes much sense. Well, Dr. Denice, thank you so much for sharing this, valuable information as well as your personal story on fertility, and congratulations on the pregnancy.
Thank you. I'm really looking forward to meeting the new family member.
Yeah, it's so exciting. If people want to find you, can you please give us your website?
Sure. My website is transformationalhealthcare.net.
Great.
Yes, and my email is on there. My front desk email is on there, and all my contact information.
Okay, wonderful. Any last thoughts you want to share?
Just for people to let go a little bit.
Yeah.
And have fun. It should be a happy, exciting time, and just if you start to feel anxious or you don't feel good in your body, then just look at that and find out where is this coming from. Just really do that, because I just see so many women who have so much anxiety around conception and infertility. So it's okay. It's normal to feel a little uncomfortable if it's not happening for you. But just examine where the anxiety is coming from and just try and keep that under control, because we don't want to do anything to undermine that healthy process that we want so badly.
Right. Well, thank you so much for coming on today, and I cannot wait to meet your baby.
Oh, good. Yep, Aunt Laura.
That's right.
All right. Thanks so much, Dr. Laura.
Okay. Bye.
Okay. Bye-bye.